My name is Brian G. Austria from Section 1-4 of BS Criminology, and I'm here to explain my topic, which is premenstrual syndrome and battered child syndrome. So let's start. Let's start with premenstrual syndrome. So what is premenstrual syndrome? So it is a combination of physical and emotional symptoms that many women get after ovulation and before the start of menstrual period. So, it is a mix of both emotional and physical symptoms that some of the women will get after the discharge of mature ovum or ovulation from the ovary and before the start of menstrual cycle. And also said that premenstrual syndrome happens in the days after the ovulation because the hormone level begins falling dramatically, and when the symptoms go away, it will disappear after a few days after the period, and then the hormone levels begin to rise again. So next is, what are the symptoms of premenstrual syndrome? First, we have abdominal bloating, abdominal pain, sore breast, acne, food cravings, diarrhea, headache, fatigue, irritability, anxiety, depression, and emotional outbursts. So if the woman felt some of these symptoms, it is possible that she have a premenstrual syndrome. So next is, who can get the premenstrual syndrome? As many as 3 in 4 women say they get the PMS symptoms at some point in their lifetime. So it means almost all of the women possess of the PMS, but they will get mild symptoms only. Less than 5% of childbearing age get more severe form of PMS. So only a small quantity of women will get the severe symptoms, especially pregnant women. It is the severe symptoms. It is called the dysphoric disorder or PMDD. Severe premenstrual syndrome or premenstrual dysphoric disorder. It is a severe PMS. Symptoms are rare or small percentage of women who have severe symptoms or PMDD. PMDD affects between 3 out of 8% of women. So, the unusual effect of severe PMS can only get by a few women. These are the symptoms of premenstrual dysphoric disorder: depression, thoughts of suicide, panic attack, extreme anxiety, crying spells, insomnia, and painful cramping. Next is, can be PMS prevented or avoided? The answer is no. You can ease the premenstrual syndrome only by doing a healthy habit, like eating a portion of healthy food, having a healthy diet, and exercise regularly to minimize the symptoms of premenstrual syndrome. So the next that we need to know is, how is the treatment of premenstrual syndrome? So as you can read on the PPT, there's no cure for premenstrual syndrome, or hindi siya nagagamot, but taking a medicine may help to at least ease the pain, like over-the-counter pain relievers such as ibuprofen, aspirin, like that. That can reduce the pain that causes the premenstrual syndrome. But if the pain reliever that you are taking is not work out well for you, you need to find another medical treatment that's effective for the patient that have a premenstrual syndrome. Here are the tips on controlling a premenstrual syndrome. First, eat complex carbohydrates such as whole grain breads, pasta, and cereals. And syempre, need mo din kumain ng mga foods na merong fiber and proteins. Then, the next tips are to avoid salt for the last few days before your period to reduce bloating and fluid retention. So, need to prevent salty food para mabawasan yung pagdudubi at pagdudubi din ng liquid. Is to cut back the caffeine to feel less tense and irritable to ease breast soreness. So, minimize lang po natin yung pag-inom ng kape to feel slighter tense, also to lessen the feeling irritable, and also to lessen the breast soreness. The next one is to cut out the alcohol to preventing depression, because if you are drinking before your period, you can feel more depressed. try eating up to 6 meals a day instead of 3 larger ones. So, it means avoid po natin yung pagkain ng madami ng iisang plato lang. Naapaw na talaga sa may plato. Instead po is kumain po tayo ng at least 6 meals a day, pero katamtaman lang yung dami ng kinakain. So the next one is aerobic exercise. Work out at least 30 minutes and 4 to 6 times a week to have a healthy body and to get stronger immune system. So the next one is to get plenty sleep, about 8 hours a night. So ayun guys, especially sa mga girls, wag na kayong magpupuyat if hindi naman kayo mahal na pinagpupuyatan nyo. So the next is to keep a regular schedule of meals, bedtime, and exercise. So ayun, need mo lang sundin yung schedule mo, kumain na nasa tama, nasa oras to have a healthy lifestyle and to have a better life. So the last one is to try to schedule a stressful events for the week after your period. So example, after ng period mo is may exam kayo next week and or marami kang activities, so need mo i-schedule yun para malaman mo kung kailan mo gagawin at para mabawasan para ma-ease yung stress mo. So that's all for my first topic, and let's move forward to next topic. The title of our next topic is Battered Child Syndrome. So let's start. So Battered Child Syndrome or BCS refers to non-accidental injuries sustained by a child as a result of physical abuse, usually inflicted by adults or caregiver. So in simple terms, Battered Child Syndrome is a physical abuse on the child that causes non-accidental injuries by the one who taking care of the child. Usually the one who did this on the child is caregiver, parents, maybe teacher, or someone in the family. If someone is caught in the act doing this on the child, he or she can be punished by the law under the Republic Act of 7610, Special Protection of Children Against Abuse, Exploitation, and Discrimination of Act, and Act providing for stronger deterrence and special protection against the child abuse, exploitation, and discrimination, providing penalties for its violation and others purposes. So ayun, pwede ka makasuhan kapag nahuli ka na ginagawa mo sa isang bata. Child abuse is referred to as behavior in which the child is exposed to a different physical and sexual abuses, neglect, or emotional misconduct. The clinical condition of the serious physical child abuse by parents or caregivers is called the Battered Child Syndrome. So if the child was experienced physical and sexual abuses and neglect or emotional misconduct on the one who taking care of him or her, the child is to report to the police or to someone who in the authority. Here are the some photos of example of children who experience the Battered Child Syndrome. As you can see in the picture, may mga pasa, may mga injuries yung mga bata, ganun po. Next is the Battered Child Syndrome. Describe non-accidental trauma to children, representing a major cause of morbidity or mortality during childhood. So because of that trauma on children, they are scared of the possibility that the incident will happen again. Also, because of too much abuse, nagiging cause siya ng pagkamatay or pagkakasakit ng bata. Next, like what I said earlier, is the abuse usually inflicted by boyfriend, step-parents, babysitter, and other responsible on the children. Abuse is more common among stepchildren, handicapped, and firstborn children. So, most of the victims are younger than 2 years old within reported average age of 16 months. So, most of the victims are too young because they can defend themselves. to someone who want to abuse them. Bakit nga ba nangyayari yon? So, here are the some causes and symptoms of battered child syndrome.
Child syndrome or BSC is found at very high level of society. Although the incidence may be higher in lower income households, where adult caregivers may suffer great stress and social difficulties and have a greater lack of control over stressful situations. So basically, the cause of able to hurt and abuse the child is too much depression, too many problems, lack of control over their emotions. In certain scenarios that will cause hurting or abusing the children. Child abusers were often abused as children themselves and do not realize that the abuse is not an appropriate disciplinary technique. Abusers also often have a poor impulse of control and do not understand the consequences of their actions. Some of the abusers not manner well to just remind the children of their actions. Dahil sa iba yung way nila ng pagdisiplina is nasasaktan nila yung mga bata pero akala nila is yun yung tamang way of discipline. Also, abusers don't have long patience and control in their emotions. And also, they didn't know the consequences or results of their actions kaya paulit-ulit nila itong ginagawa sa mga bata. Next are the symptoms that you need to know if this already happening in your child. If your child has cigarette burns, scarred marks, bite marks, or black eyes, or a lot of serious injury, possibly they are already suffering from abuse by their caretaker or anybody that taking care of your child. So next is the prevention or how to avoid being a victim of battered child syndrome. Use of educational programs to teach caregivers parenting skills and to be aware of abusive behavior. So through proper teaching on the caregiver to enhance their parenting skills, they can avoid the tendencies of being abusive in the child. Recognizing the potential for child abuse and the seeking or offering of intervention, counseling, and training in good parenting skills before battered child syndrome occurs in the best way to prevent the abuse. So it means before you hire someone to take care of your child, just make it sure that the person that you hired is already done in counseling and have a training experience in a good parenting skills to make it sure the safety of your child.
So that's it guys. I hope that you learned something from what I've recorded to you guys. Thank you and stay safe everyone and peace.